Hi, welcome to Healthcare in Context. My name is Charlotte Seyfried. I am a breast cancer survivor, a caregiver, and a patient advocate, and I'm the founder and creator of charlottepxp.com. And this is my partner.
Hey, I'm Caitlin Holcomb, founder of Wellness Communities. I'm a certified community health worker through Baylor Scott and White, and shortly after earning my MBA, I quit my job to start focusing full-time on helping people to dwell in wellness. And welcome to our series, Healthcare in Context. We call it this because contextual care matters. In fact, evidence shows that paying attention to contextual care factors improves the likelihood of positive medical outcomes by 70%.
We want to remind everyone that we are not doctors. Anything we say here is not to be construed as medical advice.
All right. So I've shared the whole tale of woe. So where else should we go with this?
Well, and I don't know if it's important to record, but just like a side thing that I've learned, with running in particular, there's something called EMDR, which is eye desensitization movement reprocessing. And it's like as you're running, and I could see this probably also being true with tennis, but basically that bilateral stimulation helps your brain emotionally and mentally process hard things, those gut punches that you've been through,
That's
and
interesting.
figure out how to deal with it.
That's a form of meditation.
Yeah, they use it for post-traumatic stress healing a lot.
Do they really? Well, I
Yeah.
find that like boxing and tennis, like hitting a ball, like, or punching, very therapeutic. Definitely. I like, if I don't do that once a day, one or the other, it's not good. Running does fulfill that as well, but I need, like, every day, I need like some sort of serious exercise where I can just kind of check my brain at the door. I don't bring my phone into boxing. I bring my phone when I run, but just for the music. I put it on airplane mode because I need the mental release. And I'll tell you, like, that was one really nice part about, if there's a nice part about being in a hospital or rehab center, was, especially when I was in the hospital, I didn't have my phone. So like 6 weeks, like, no one heard from me. And that was, people knew something was up because I wasn't posting on LinkedIn because I'm so active on LinkedIn. So that was kind of like just a forced disconnect. And it also gave me a lot of time to think about me and kind of what I wanted now, and kind of life part two. And I think that was also really helpful. So that was kind of the upside of being by myself for so long.
Yeah. I'm glad you used it for healing. Sounds like you always use your time really well.
I don't know. This week I've done a little bit too much, but that's fine.
Well, and I don't know about you, but I imagine for me, the idea of like when that physical activity is part of how I cope with stress, and then you no longer have that outlet anymore. I imagine that was part of what was so frustrating, and that's what I find fascinating about how there was that fear there too.
Okay, well, here's something that's interesting. Is there wasn't one day where I was laying in the hospital that I wanted to run.
Yeah.
I think my brain knew that it was not in any condition to do anything physical.
Yeah.
And I think psychologically, I needed to get to the point, like when I described that moment on the treadmill, where I needed to get curious about, can I do this again? And then that was the curiosity that led me to, go over there and hit that button. And put my headphones in and I run to the Foo Fighters. Like I love the Foo Fighters. And so Everlong, like that whole I love that. And I so like last year on Spotify, when I got my Wrapped, like I was like the top 1% of the 1% of Foo Fighters listeners, because every time I run now, I listen to the Foo Fighters. And they're touring this summer and I got tickets. I've never seen them. And it was like, they're so, when I run now, like I have to listen to the Foo Fighters. I've tried other bands, but I always go back to the Foo Fighters. And I just like that now is who I like associate like working out with. And so when I really want it, like to put on like, one of their like, I don't know, headbanger type of albums and just go for it. It is like so fun. So
When I saw
funny
them
what you
concert last, they saved Everlong for the encore. Just a heads up.
such a good.
That's amazing, though. It sounds like you went through such an emotional process. I feel like for me personally, I can identify with that because I think there was a part of me that I couldn't be curious about it or try until I was ready to know whether I could do it or not, and if I'd be okay with failing or with it not feeling the same. And I completely understand that process, and I think leaving room for that process is really important. Sometimes we don't want to do that. We want to immediately try to like jump right back into everything, and we really need to be aware of our bodies and sort of connected and recognize that we're ready when we're ready, right? And
Well, you have to be kind to yourself. You
yeah,
have to give your
yes,
body time to heal. You have to be gracious with yourself. And I think that so many people try to rush, and that's not going to help you. Like when I woke up from the coma, I whispered to the doctor, "What do I need to do to be in the classroom in September?" He's like, "You need to be patient. You need to give yourself time. You need to listen to everything that I tell you, and you need to do it." And I did. And like I said, I got kicked out of rehab a week early, and I was back in the classroom in September. So
yeah,
that was amazing.
you did everything right.
I tried. And yeah, and I went to the hospital because if I didn't, we wouldn't be having this conversation. And I think
Wow, yeah.
that for so many people is like absolutely terrifying. But
And you
unfortunately,
had great treatment, and they figured out what was wrong with you.
yeah,
They
that's
treated
right.
my firstborn with sepsis as an infant, but they didn't. You know how it takes them about a week to actually find out what bacteria it is that's infected. So they didn't know whether that was what it was or not, but they thought that they would go ahead and treat him for it just because that's the worst possible thing that it could be. And I wonder how that process was when you were unconscious. How many people had to fight for you or you know, make sure that you got the appropriate testing and that you got those medications. Uh, it's
Well, that was where my sister came in, right?
yes.
Because she got the call. So my husband called her, I guess it was Friday when he found out.
Mhm.
And she dropped. She's a physician on the West Coast, and she was rounding with her students. And she said she got the call and she was shocked. And she said to her colleague, "My sister's literally dying in the hospital. She has strep A." And her colleague is also an infectious disease doctor. And like both of their eyes kind of popped out of their head. And she said she was on the next cross country flight. So when she got to the hospital, she met with the ID doctor and then she rounded everybody and said, "What is the treatment protocol?" And she said the hospital that I was at was a very, very good hospital, but it's not an Ivy League hospital. Let's put it like
Mhm.
that. And she thought initially when she heard what happened that I was going to need to be transferred. But she said she was so impressed by the quality of the care and the level of knowledge they had already achieved in like 24 hours
Mhm.
that I stayed there and I did get the best treatment. I had the
Good.
best doctors and I'm just very, very, very fortunate. Very fortunate.
What made that quality of care impressive to her?
What made it what?
You said that she was so impressed by that quality of care that she eventually let go of the fight of getting you transferred. What impressed her about the quality of care?
I think it was the depth of knowledge. Like they called it very early. The infectious disease doctor was like, "I think this is strep A," because like it was things were happening so crazy. And
Mhm.
she said the level of testing that they had done and the workup that they had done, and
Mhm.
like they knew everything by the time like she got there. I think midday Saturday, and they had already figured everything out.
Mhm.
Um, what they didn't expect was the clotting on Sunday. That was what, and and when she saw that, she was like, "Oh, damn! Like this is really bad," because that happens in 50 to 60% of the cases. But she was praying deep down inside that it wouldn't happen. But because that's obviously what led to the gangrene. But it's like, as I'm reminded by people all the time, I'm so fortunate that I got out the way that I did. I mean, the amputations, I hate that word, but the amputations could have been much, 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 much worse than they were. Um, uh, and that would really have compromised my quality of life, which would have been very, very hard for me, honestly. I didn't really, before this happened, I didn't really appreciate how much I thrived on being independent, but I do. And so the fact that that was almost taken away from me is pretty scary.
I was going to say, just as an aside, though, sepsis is notoriously difficult for them to diagnose. And oftentimes, the fact that they were able to spot what sort of bacteria it was, I think, probably made a huge difference in your treatment as well. And that's really impressive.
Yeah, no, yeah.
If it's all right, I'd like to talk a little bit about, in the time that we have left, about your recovery. You've shared some things with me, and I'd love to hear more about them in terms of what were some of those friction points that you encountered in that recovery. And if you had a magic wand that you could wave to fix things, to make things easier if anyone else were to experience this again, how would you wave it?
I think so. For me, what made my treatment plan hard was sepsis. Is what I had is so rare. Strep A induced toxic shock is so rare. So they were treating the symptoms, but they couldn't treat the totality of it because there kind of is no totality. It's just a bacteria infection, and how the bacteria infects you is different for everybody.
Okay, great.
All right, I'm on my phone now, so it probably won't cut off.
Yeah, that'll probably be a stronger connection. Do you want me to repeat the question?
No, I mean, I think I get it. So in terms of like the frustrations, it was definitely that, there's no one who's an expert on this. So it was a matter of treating the symptoms as opposed to treating the problem. But then again, no one knows how an infection is going to affect a person. So they were doing the best they could. So that was the one challenge, was like there was no one doctor that could tell me what the treatment plan was going to be, because they were all, subject matter experts. I think the second was that because hospitals run on shifts, I would see 3 different nephrologists in one day who would all ask me the same question, and I would have to answer, and would have, and no one ever read the charts, right? So that was really frustrating. So I learned to say to them, like, did you read the chart? Like literally, it's when the doctor would walk in, before they ask me, I'm like, take a read of the chart before you come in, so that you know what's going on. And the third thing I think was, there was a frustration for me in that there wasn't always communication between all of the doctors, even though they were all in the same hospital and all had the same access to the same records, because they're all so busy. And, when they round, they come, they meet, they talk about you like you're not there, and you are. They think you don't understand what they're saying, but you do. And, there was one day where they were like talking about me. It was 2 doctors and 4 nurses. And I was like, you realize I'm laying right here and I can hear everything that you're saying. And I understand. And one of them looked at me, they're like, oh, I'm like, yeah. And then there was a time about 2 weeks before I got out of the hospital where they were coming in and still taking my blood like every 4 hours. And anyone who's been in that situation, you feel like you're being pinpricked constantly. And so the doctor was in the room, and I said, do you know why they're still taking my blood? I'm like, I'm not on any machines or anything. Like, they're just waiting for me to get my blood pressure stabilized. And he said, as a question to the nurse, we're still drawing her blood. And I said, yeah, they are. And the nurse was like, oh yeah, she's right. I'm like, of course, it's my body. And he goes, well, you shouldn't be doing that anymore. And it was just, no one had put the order in, no one had put in the thing. And so I learned from that experience that when you're in the hospital, you have to advocate for yourself.
Yeah.
And there's a really important word, and it's no. And before the doctor made the change order to stop taking the blood, I got to the point like 2 days before that, over the weekend, where I was like, you're not taking it anymore. And you as a patient can refuse service. I did not know that early on, but I learned it while I was there. So I think if I could wave my wand, um, somebody would give you an overview when you get checked into the hospital as to your patient's rights, because I think that's really important.
Oh,
Um, and I think that the other thing is, as I said, when I first started, like we first started talking about, it's really important that you think about when someone asks you for your emergency contact, that those are people that are going to help you. And in my case, it was, but like that is not a passing question. That is one of the most important questions that you have on any medical consent form. And I feel like people just, check that stuff off like it's. So I think that's really important as well. So I think there needs to be patient education in hospitals. I think that would go a long way. And I also think there needs to be family education on ways to support patients. It's nice to have someone and sit by your bed and hold your hand while you're watching the fourth hour of the Today Show.
Yeah.
But there's a lot of other stuff a person could do. And I think um, not just thinking about someone's physical health, but their mental health is really, really important. And I feel like in hospitals, we try to treat the physical conditions because that's when we can get somebody out and clear that bed. And the reality is the mental health needs to be in tow as well. And I was very lucky because, as I said earlier, like I'm usually in pretty good mental health shape. And I did have people that came and, but I had to ask to talk to the hospital therapist. It
Yeah.
wasn't offered to me. And I was really glad that my sister, said like, look, like anything you need, you ask for and it will come to you. And
Yeah.
it did. But you have to ask. People aren't going to offer it up. And I can't underscore how incredibly important that is to ask for what you need and to say no to something when you don't want it. And also ask why. Why
Yeah.
are you doing this test? Why are you giving me that medication? Why am I still on it? That is why and no are two of the most important words you can use as a patient, and also two of the most important words you can use as an advocate for the patient. And doctors don't know everything. And I think that's something I learned as well. Is like they only know what they're trained in or what they subspecialty and they don't know everything. And so if a doctor says, you know what, I don't know, that's not my area of expertise, that's okay. They're allowed to say that. And it's like, it's like anything in life. Like, are you going to go to a French restaurant and ask them for a plate of pasta? No, because the pasta comes from the Italian restaurant. The beef bourguignon comes from the French. You're not going to ask the French chef to make you pasta. You're not going to ask the Italian chef to make you, beef bourguignon. So it's like, you have to remember that like these people are trained to work in a specialty or a subspecialty. And that is what they know. And if they don't offer their opinion, that's because they're not supposed to. And I think that's also something that
Yeah.
we all, I know I was always searching for answers. And so every doctor that would walk in the room, I would ask them a question that may or may not have been their area of specialty. And sometimes I would get frustrated that I couldn't get a straight answer, but it was because the right person wasn't in the room to ask the question of. And so those are kind of lessons that I learned. And if I could wave my magic wand, I would have patient education and I would, just empower people to ask questions. Cause I think so many things happen in hospitals because of oversight or because of people don't ask the right questions. And just saying why, that's like a really good thing to do.
Wow. Those are all amazing tips. Yes,
Thank you.
I feel like there should be like a graphic for each one. And as you were speaking, I kept thinking, wouldn't it be amazing if when you woke up, you could see like a poster board in your room that
Yeah,
told you what your rights were and
that's right.
reminded you of a lot of the things that you brought up, like ask
Well,
why.
because they write on that whiteboard, like every hospital room has a whiteboard. They
Yeah.
write it who your nurses and have a section that has like patient rights and has like, most commonly for or most questions that should be asked,
hmm
and I just think that's so incredibly important. So I know like when I find out that friends are going to the hospital or have a loved one in the hospital or whatever the situation is, I'm always like, look, make sure you question everything they do.
I love it.
And it's not coming across as snarky. It's just
No.
coming across as like you want to be an intelligent patient
Yeah.
and you want to be an intelligent advocate. And the only way to do that is to ask. That's it.
Yes. I I think, and I love the way that you phrase it so simply. Ask why, right? No, say no. I think those are all
Yeah.
very simple, amazing tips that any one of us could use, not only in healthcare, but just in life in general, right?
Well, thank you. Yeah,
Yeah.
yeah, yeah.
But and your point of it's not that in asking you're undermining that they have a subject matter expert in that. No,
Yeah.
it's your whole body. good for you to be informed.
That's right.
Going on
Yeah.
with your body, your mind, all of it, your whole health.
Yeah.
That's right.
And with Dr. Google, they're all used to everyone asking questions anyway. You might as well use it to your advantage, right?
Exactly.
Well, you're not bringing
Exactly.
in WebMD and being like, well, actually, this is what they say. That's different.
They are used to that though. Like they know that that's a thing they're used to now. So don't be afraid to ask questions that really apply to you that you need to know about.
Asking why and taking that moment to pause. And like I've seen, you said 3 different nephrologists. Can we pause?
It was insane. And I had to, and I had to, did you see the chart? Did you see the numbers? Oh no, and the other thing is, God, I just lost it. I just, just ask questions. The more now knowledge is power in this case, and the more empowered you are as a patient or as an advocate, the better. I think I do really do believe the better the outcome is going to be, and the less mistakes there are going to be. So I cannot underscore enough as a patient. There were so many times where I just could have deferred to the doctor. And when I was, woke up from the coma and could barely talk, I did a lot of that. But as soon as I got my voice back, even a morsel of my voice, I questioned everything.
Good.
And that radically changed my quality of life. There were certain things they wanted to do that I said no to. There's got to be a better way. There's got to be another option. And we found them. And that's incredibly important when you're in a hospital.
Yeah.
Well, and I know once you were discharged, part of what you've shared with me about your story was that you also did a significant amount of research, like when it came to the prosthetic for your thumb.
I did.
I
did.
The amount of time and research that you put into. Can you tell us a little bit about that?
Yeah. So the surgeon that took off the top of the right thumb, I asked him about a prosthetic. He's like, I have no idea. No idea. Literally, that's how he said it. And he said, he's like, oh, well, I'll find something for you. So a couple of weeks later, I went for a checkup with him, and he's like, oh, I have something for you. And he pulled it out of his pocket, and it looked like it was something he bought at the Halloween store. It was like a plastic pop-on thumb. And his nurse looked at it and said, did you get that at the Halloween? Because this was October. She's like, did you get that at the Halloween store? And he was like, no. She's like, what, did you order it on Amazon? Right. And I brought it home and I was like, this is pathetic. Yeah. And I had made some calls to some large hospitals in the Midwest for their guidance. And they referred me to hospitals in my area and within driving range, and to one person specifically who specializes in ocular, so eyes, ears, hands, and feet prosthetics. That's all he does.
Wow.
And he's at a large research hospital. So he also has grants. So I have 3 thumbs. One of them is one of the first ones in the US to work with an iPad. So it has like a touch thing on the bottom that emulates, because the touch screens work on temperature of the body. And so this one pretends that it's like temperature. I don't know how it does it, but it does. And it interacts with the iPhone. So that was kind of cool. And that was because of a grant. So, but yeah, it took several phone calls, several conversations. I talked to a bunch of different people and ultimately decided this person, because of the hospital that he's affiliated with, was the right way to go. And he's amazing. We're actually probably collaborating on things. I'm probably going to have him on my podcast at some point. Because some of the work that he does is, just absolutely incredible. So and it was all made because I just could have stuck with the pop-up that the surgeon gave me out of his pocket, or I could have done what I did. And it was several visits to make sure it was right. Yeah. But it's great. No one even knows it's a prosthetic. So that was, well, and something else I should probably mention is, like, one of the things that I said, like, so there was with the gangrene, like, they, it's dead tissue. So before they cut off the top of the thumb, I went through 20 treatments of hyperbaric oxygen therapy to try to get tissue growth. And that helped me save the bottom part of the thumb. Otherwise, I could have lost the whole thing. And that would have been problematic, because I can do most things with that now. Even though I don't have the tip, I can still do most things. But if I hadn't had it, there's no way I could have played tennis. I mean, that's just an example. So I asked, there's got to be something else that we could do. And one of the doctors was like, well, there's this doctor who does such and such with hyperbaric oxygen. I was like, find that person for me.
Wow.
And we went for
Yeah.
the consult. And he said, let's try it. We got insurance to pay for it, which took a lot. It was like a Herculean effort, several letters, but we got them to pay for it. And it helped. And so they didn't have to take off as much as they thought they were going to, which is great.
That's another important thing for people to
Yes.
understand exists. In the breast cancer world, you know that we deal with that a lot as well. And no one knows about the hyperbaric oxygen and
No.
that is even an option. So I'm so glad that you got that treatment. And I'm so glad
Oh, thank you.
that it helped as well.
Thank you. It helped. It absolutely helped. Yeah, it really did. So it was like really transformative, I have to say.
How do we get this to more people? How do more people find out about this? I hate that the onus is always placed on us that we have to ask to find these things because you can't always ask, right?
No, well, here's the best part of this story is after I got the really good prosthetic, I said to the doctor that done the surgery, do you want the information of the guy that did this for me and the hospital so you can refer other people? He said, no. If people want it, they got to figure it out for themselves.
Wow. Yeah.
So I gave it to the nurse and she said, thank you. And I said, I'm sure she goes, I'll pass along. And I know she has to some people because what he did for me it was so important. With the guy, making the prosthetic is so important because I can elect to choose to talk about what happened or I can hide it by just wearing the prosthetic.
Yes.
And that's putting the power in my hands. And that's really important after going through something like what I went through.
Mm-hmm. It's part of
So
healing.
yeah, it is.
Yeah.
It is. So yeah, so that was a crazy part of the whole thing, but you learn so much. And I think, over time you just kind of keep rolling with the punches and one thing comes, but you get stronger and stronger as you go through the experience. And you come out hopefully a better version of yourself, in my case, minus the tip of the thumb. And you also, I think, see the flaws in what is perceived as a perfect system. It's far from perfect. But you can make it manageable if you ask the right questions and say no and why along the way.
Oh, beautiful.
Well, and the fact that there were, like, you had your sister, you had
Yes.
folks at those Midwest hospitals. The fact that there were people that you could call to help you find the right folks, and the fact that you had the digital and health literacy to do the research to find some of the, like, I'm grateful that you did have that.
Thank you.
Exactly.
Thank you.
It's also
Thank
one of
you.
the
I think
reasons that we're working so hard to help make that more accessible for everyone else, because everyone should have access to that information. And think about all the people. I'm so glad you were able to speak again, but I bet you that whole time that you couldn't, you were you were just waiting. You were waiting for that time where you could again.
and I got so bored of the Today Show, let me tell you. I can't watch it anymore.
I bet.
I watch Good Morning America. Yeah, no, it was hard, but you know what? I'm okay. That's the important thing.
Yeah. I'm so glad. I'm so glad we got to meet you and you get to stick around and share all the things that you learned and help people and continue to be the powerhouse that you are.
Oh, you guys are sweet. I hope to meet you guys in person at some point too. That'd be
Yeah,
fun.
absolutely.
We'd like to give a big thank you to our guests, and we hope that you'll join us for the next episode. Context is everything, and healthcare and life. If you believe in what we're doing and want to support us, please remember to like, subscribe, and share our channel. Reach out if you want to be on our show, or you think we should cover another topic. What did you learn from the show today? We want to hear from you. Contact us at hcincontext@gmail.com. Leave a comment or look us up at wellnesscommunities.com. One of the most common questions I get asked as a cancer survivor is, what should I send to my loved one who was recently diagnosed? So that's why I helped create a curated list of products at wellnesscommunities.com in the Shop tab. It contains products that are tested and recommended by the people on our show, including me. We'll take a portion of proceeds and donate it to Undo Medical Debt. For every dollar donated, it will pay off $100 of debt. It also helps us continue to share these stories with you. We wish you wellness. And if you aren't feeling well, remember, there are people out there working hard to make you feel better. See you soon. Until then, take care of yourself and stay cozy.